Adam Teichman, who is the principal partner in PA Foot and Ankle Associates, pafootdoctors.com. That's pafootdoctors.com, *foot on your mobile device, and he is the chief of podiatric surgery at Sacred Heart Hospital. He also is at the Sacred Heart Wound Care Center. He is teaches the intern at St. Luke's, an instructor over there, and he's also the official team podiatrist of the Iron Pigs. With Dr. Teichman, your feet are in good hands. Dr. Teichman is as cornball as I can.
I'm going to trade back that for you. Just like Allstate. Can everybody see me? I don't know if I want to stand up on the stage. I might fall off. So, but we got some good doctors here in case I do fall off. So, can you guys hear me okay? All right. It's a little awkward for me to have this wrapped around my head, but we'll see if it'll work. So today we're going to be talking about emerging trends in diabetes. And just so you guys know, we are live on Facebook right now, so that's pretty exciting. So if anybody has any family members you want to wave to, go right ahead. So again, emerging trends in diabetes. So we're going to talk about diabetes, and hopefully at the end of this you'll walk away with some good information and how the rescue products can also help you manage your diabetes along with diabetes, such as, we talk about high blood pressure, cholesterol, and glucose control is very important, which we're going to talk about, and how we can manage glucose control and the benefits of controlling our blood sugar. So I try to be a little creative today with our PowerPoint. So the questions of the day, the two questions we're going to try and answer today is, number one is, can type 2 diabetes be prevented? And if you guys listen to me on the radio show, we definitely talk about that. And then also, can people living with diabetes live long and healthy lives? And that's our goal, right? Is to live a long and healthy life. So we're going to try and answer these questions throughout our discussion today. And if you have any questions along the way, just raise your hand up and I'll probably ignore you till the end. But if you do have a question, I will definitely answer it right away about anything, including diabetes. So, some statistics. Prevalence of diabetes in the United States. An estimated 30.3 million people are diagnosed with diabetes. That's 10% of the population. Do you think this number is going to increase over time? It definitely is. They said by 2050, 12 to 15% of the population in the United States is going to be diagnosed with diabetes. Is this preventable? It definitely is. Preventable with changes in lifestyle, diet, and supplementation. It's up to you to make the decision to be proactive in your healthcare. And controlling diabetes is number one, is being proactive, changing your lifestyle. The percentage of adults with diabetes increases with age. They say a quarter of the population of diabetes is 65 years or older. Why is that? Because insulin resistance, our body does not use insulin efficiently as we grow older. Insulin resistance increases as we grow older. How do we correct that? Through supplementation. We'll talk about Rescue 105 Max, 1250. All helps with blood sugar metabolism and also helping insulin production, producing more insulin for us as well, bringing that sugar out of the blood into the cells. In the last 20 years, the number of adults diagnosed with diabetes has more than tripled. It's an epidemic because of the fact that people are overweight and obese, lack of exercise. All these things contribute to diabetes. These are the number one reason why people develop diabetes is lack of exercise, improper diet. We're all on the run, we're all on the go. We want to eat fast food, we want the quick fix. That's what causes diabetes. We have to make sure that we adjust our lifestyle and change our lifestyle to control diabetes and also prevent diabetes as well. One of the main causes of diabetes, according to the Surgeon General, is smoking. Anybody smoke here? Are any smokers in the audience? You don't have to admit it. I don't smoke. Smoking is very bad. Increases oxidative stress on the body, increases free radicals, ultimately leads to inflammation. And what that can ultimately lead to is diabetes. The Surgeon General has confirmed that smoking causes type 2 diabetes. People who smoke have a greater risk of developing type 2 diabetes more than non-smokers. So if you're smoking, I can't stress it more importantly enough to stop smoking. Be proactive. Diabetes is the leading cause of kidney failure, non-traumatic lower limb amputations, and new cases of blindness among adults in the United States. We talked about this morning, some of the devastating effects diabetes can have. Amputations, non-traumatic amputations. Again, a lot of these things are preventable. Being proactive, being aware, controlling your blood sugar, seeing a specialist as a preventative measure. And diabetes is a major cause of heart disease and stroke, the 7th leading cause of death in the United States. That's a staggering information. That has not changed over the past 5-10 years. It's still one of the top 10 causes of death in the United States. How can we control that? How can we reverse that? Being proactive, changing our lifestyle, exercise, diet as well. So, when we talk about diabetes, we want to talk about type 2 diabetes and pre-diabetes. Diabetes before, or the doctor said you're pre-diabetic. Well, what does that mean? Has anybody ever told you, what does it mean to be pre-diabetic? You're like, am I really diabetic or am I not diabetic? I don't know. Am I in that middle phase? Well, I'm going to explain what pre-diabetes is, and then we'll also go over exactly what type 2 diabetes is. And there's probably a lot of type 2 people, diabetics in this audience right now. Well, we'll just review that, and some people might not really understand why they're diabetic or what does type 2 diabetes mean. Understand the difference. So type 2 diabetes means we have high blood sugar. There's sugar hanging out in our blood. It's unable to be transferred into the cell because of the fact that the body is not using insulin efficiently enough. What does insulin do? Insulin is like a allow sugar in. And if we can't get sugar into the cell, what happens? Our body, we want to eat more because our body's saying we need more energy, but we can't bring it into the cell. And what does that mean when we eat more is we get obese, we gain weight. So those are some of the risk factors that can contribute to diabetes because we cannot bring the energy into the cell. So we eat more. We don't want to exercise a lot because we're tired. We're left. So when the insulin is not doing its job, we call that insulin resistance. And what happens with insulin resistance? The body starts to produce more insulin because we're not using insulin efficiently enough. That's called hyperinsulinemia. And some people might say, well, I'm insulin resistant, but I'm not diabetic. Well, why is that? Because the early stages of type 2 diabetes is insulin resistance. Our body is not using insulin efficiently enough. So the way I describe it too is if you are diabetic and you have insulin resistance, what happens is insulin hits the cell but bounces off. It's not doing its job because the cell is not allowing insulin to unlock the cell to get the sugar in. So how do we do that? How do we get more sugar into the cell? Sometimes prescription medication. Metformin helps with blood sugar control as well. Genumet is another one. But how can we do this naturally? How can we do this as a supplementation without the side effects of the medicinal treatments? And that's where Rescue 105 comes into play. Rescue 1250, and I like the 1250 plus with the vitamin D3 because vitamin D3 is a great antioxidant, lowers inflammation, also helps with blood sugar metabolism. And then we'll talk about Metabolock and magnesium as well as great supplements to control blood sugar and also prevent or prolong the onset to some of the complications that can go along with diabetes. And so what happens when glucose builds up in the bloodstream and cannot get into the cells like we talked about? Your cells starve for energy. We become tired because we're not getting that energy from the sugar. And what happens when that sugar hangs out in the blood over time? It can hurt your eyes, your kidneys, your nerves, and your heart. And me being a foot and ankle specialist, I see these negative effects occur in the feet with neuropathy, loss of circulation, ultimately lead to ulceration, and possibly amputation. But again, these are all preventable. These are all preventable by making lifestyle changes. You, as the client or the patient, have the option to control these outcomes by making the right choices. So pre-diabetes. Pre-diabetes is a condition in which individuals have a blood glucose or A1C level higher than normal, but not enough to be classified as diabetic. And as we know with pre-diabetes, the numbers around 100 to 125 is pre-diabetic. Anything over 125 is a type 2 diabetic. So you don't want to think of pre-diabetes as a condition like type 2 diabetes. According to the American Diabetes Association, pre-diabetes should not be viewed as a clinical entity, meaning a diagnosis. It's a risk factor. It's increasing your risk for developing diabetes and cardiovascular disease. So that you are pre-diabetic, what does that mean? he's saying that you are at risk of developing type 2 diabetes and cardiovascular disease. You might have high blood pressure, high cholesterol. All these things are putting you at this risk factor of developing type 2 diabetes. We've talked about metabolic syndrome before. Has anybody ever heard of metabolic syndrome before? I've listened to the radio. These are these risk factors that are putting you at risk for developing diabetes. That's obesity, carrying that belly fat. I might carry some right now. Also, you might have high blood pressure, high cholesterol as well, uncontrolled blood sugars. Those are all a bunch of those risk factors that are putting you at a higher risk of developing type 2 diabetes and cardiovascular disease. So be aware that pre-diabetes is not a diagnosis, but it's a risk factor saying you are at risk of developing a problem such as diabetes and cardiovascular disease. So pre-diabetes in the United States increases your risk, like we said, of developing type 2 diabetes, heart disease, and stroke. An estimated 79 million Americans have pre-diabetes, and that means they don't know they have diabetes or they don't know they're pre-diabetic. And again, this number is going to be increasing as we become less active, as we make poorer food choices. A lot of people eat a lot of fast food, right? We eat these simple carbohydrates, we eat these sugar-infused products as well. You really want to be aware of that because of the fact that all these things can lead to type 2 diabetes and cardiovascular issues. Studies have shown that people with pre-diabetes who lose weight and increase their physical activity can prevent or delay type 2 diabetes, and in some cases return blood levels to normal. I was just talking to somebody as well, and they said, well, I'm pre-diabetic. Is it possible to reverse that and have my blood sugar normal and not be pre-diabetic anymore? And I said, yes, it definitely is, by making proper lifestyle choices as well. And this is where the supplementation comes into play. If you are pre-diabetic or have these risk factors, you really have to look at that and say, well, what can you do to be proactive? And that's where, again, the Rescue 105 Max comes into play, the magnesium, the Metaboloc, and also the 1250 Plus. I keep saying those 4 products because I really believe in controlling your diabetes or pre-diabetes, because what they're doing is they're addressing the oxidative stress and the inflammation in the body, and also helping with blood sugar metabolism. And we're going to go over those products in a little more detail later on at the end of this. But right now I just want to give you guys some good information about the history of type 2 diabetes and some complications and how we can control that. So, complications of diabetes: heart disease and stroke, hypertension, blindness, eye problems, kidney disease, nervous system, and ultimately sometimes amputation. Now, how many people have heard the word diabetic neuropathy before? Is everybody familiar with diabetic neuropathy? You probably see these crazy commercials online talking about Lyrica treating diabetic neuropathy. Well, these are things that can happen with uncontrolled blood sugars, and sometimes the primary indicator of diabetes for people is they develop neuropathy. They have this burning, tingling, or numbness in their feet, and they don't know they're diabetic. They go see their family doctor and they say, all right, well, let's test you for diabetes. And that could be that red flag that they might be diabetic. They might have had uncontrolled blood sugars for a period of time. Could wreak havoc on the circulatory system and ultimately the nervous system in the foot or ankle or the hands, and they develop numbness and tingling. Heart disease and stroke. We know that diabetes increases your risk of heart disease or stroke by 2 to 3 times. Blood pressure. Diabetes can increase your blood pressure as well. It affects the peripheral arterial disease, putting more stress on the circulatory system, which ultimately puts more stress on the heart. Well, and also blindness and eye problems. I know if you heard Dr. Bodeman speak, he talks a lot about the eye issues and complications affecting the eye with diabetes. So heart disease and stroke. Heart disease was accounted for 68% of diabetic-related deaths. In 2004, it accounted for 60% of diabetic deaths among people 65 years or older as well. And diabetes and with heart disease, death rates about 2 to 4 times higher than adults without diabetes. So as we know, diabetes increases your risk of cardiovascular complications. Again, this is all preventable by changing your lifestyle and being proactive in your health care. I always say it's up to you as the patient to determine to be. You have to be proactive. You have to look at your diet. You have to look at exercise. And I'm not saying go run a marathon. I'm not saying go ride a bike for 100 miles. I'm saying get outside, walk 15 minutes, 20 minutes a day. That's going to increase your cardiovascular output, put more stress on the heart, and stress on the heart is good. The heart is a muscle. The heart needs to work out. We need to get the heart circulating, working harder and harder. And that's where diet and exercise comes into play. And then supplementation as well. The risk for stroke is 2 to 4 times higher among people with diabetes. So you can see the negative impact diabetes can have on the cardiovascular system as a whole. So blood pressure, hypertension. Adults aged 20 years or older with self-reported diabetes, 60% had blood pressure greater than or equal to 140/90 and were on prescription medication. Again, diabetes having these negative impacts on these other complications. Blood pressure. Some of these are indicators of the metabolic syndrome, right? High blood pressure, high cholesterol, heart disease. The nervous system. 60-70% of people have mild to severe forms of nervous system damage, meaning they suffer neuropathy, they have numbness, tingling in their feet, slow digestion, carpal tunnel syndrome, also erectile dysfunction, tarsal tunnel syndrome in the foot or ankle as well. And also 30% of these people have, over 40, have impaired sensation in the feet. So that's neuropathy, diabetic neuropathy. And when we have impaired sensation in the feet, that puts us at risk of developing other complications such as wounds that don't heal and possibly amputation. This is all preventable, and I keep saying that because it truly is. I see it every day as a preventable treatment, and we can manage diabetes and prevent these complications from happening with proper lifestyle changes, proper supplementation, and having the right people on board with you. You have your family doctor, you have your specialist, you have an RN, you have a dietitian, you have a diabetic educator. All these things go hand in hand together to control and prevent the complications associated with diabetes. Amputations, and this is what I see in my practice dealing with these wounds, is I see a lot of people who come in with these wounds that don't heal. And then they ultimately possibly go on to amputation. Well, why is that? Because of the fact that they have improper sugar control. They need a reality check. They need to understand what the problem is. We have to control our blood sugar. We have to see the specialist when we have a problem. We have to get proper workup. If you have that, these things are not going to happen. Controlling your blood sugar, controlling peripheral arterial disease, controlling inflammation in the body, all these things are preventable with supplementation and lifestyle changes. And I keep saying that because it's true. It's up to you to make that decision to control all these complications. 2006, 65,000 non-traumatic lower limb amputations were performed. This is preventable. This number can go down by proper care, proper treatment, lifestyle changes. Blindness and eye problems, kidney disease. We're not going to study all these complications. Let's talk about the trends. So how do we manage the diabetes? How are we going to control these things? What is going to happen? So providing patient-centered care. We're no longer looking at a group or a population. We're going to look at individuals now. We're going to look at each person as an individual to assess their goals and what barriers are preventing them from achieving these goals. What's preventing you from achieving these goals? What's preventing you from making these lifestyle changes as well? And then we're going to develop a unique plan to help you promote and provide success in reaching those goals and controlling the blood sugar, controlling your blood pressure, your cholesterol as well, and getting you to see the right people you need to see to prevent some of these problems. Like we talked about, using collaborative team approach, physicians, pharmacists, nurse practitioners, specialists like myself, dietitians, certified diabetic educators, social workers, all these people have to work together, right, to get our goal, which is to get the blood sugar under control and prevent some of these complications. And lastly, which is the most important, is educating you to give you the power to make decisions in your care, right, and your own care. So basically, diabetes depends on you and your behavior patterns and your lifestyle changes. It's up to you to make the changes. We can provide the information, but it's really up to you to make these changes, to be proactive in your health care. And how do we do that? Lifestyle changes, diet, exercise, supplementation, being aware of your sugars. If your sugars went out of control, understanding that, understanding the symptoms if you have a problem, who to see, when to see them, right? Also, being proactive if you have a diabetic wound, if you are diabetic and you have foot problems, seeing the proper foot and ankle specialist. If you have if you have cholesterol issues, if you have blood pressure issues, seeing your family doctor, maybe seeing a cardiologist, being proactive. It's up to you. You have the power to make these decisions to prevent all these problems from occurring as well. Blood sugar control is always up to you. Lifestyle changes is very, very important. When I see my patients, we always talk about lifestyle changes: diet, exercise, supplementation, checking your sugar daily if you're diabetic. How many people who are diabetic check their sugar on a daily basis? How many people know what their hemoglobin A1C is? It's very important to understand those numbers, right? Because we want to know where our blood sugar is at. If our blood sugar is hanging out in that 150, 160 range, that's uncontrolled diabetes. We want that sugar to be around that 105 mark with the rescue 105. 105 to 120 is really a good goal for our blood sugar. And if you're having problem managing that, we have to look at why. What type of stresses? Dr. Levy talked about stresses in your life as well. Stress factors increase blood sugar, right? Increase your risk of developing diabetes. Sometimes we can alleviate some of those stresses in life. When you're told that you're diabetic, that's a high stress in your life, right? You think, oh my God, I'm diabetic, what do I do now? Well, you have to be proactive. You have to understand the disease and get the right treatments, get the right management, get the right team together as well. And also the right lifestyle changes: diet, exercise, assess what you eat throughout the day, assess how much exercise you're doing as well, then adding supplementation. So the goal of diabetes management, the priority is to control your blood sugar, blood pressure control, control of blood lipids, preventative care practices for the eyes, the feet, the kidneys. Again, see an eye doctor at least once a year, see a foot doctor at least annually, all right, and see your family doctor. And if you need to see a specialist, see that specialist when directed. And ultimately, lastly, the most important is lifestyle changes. Again, I keep saying it's up to you as a patient to make these changes and being proactive in controlling your blood sugar. Nobody else can keep your blood sugar under control except for you as well. If you're taking metformin, if you make sure you're compliant with it and your blood sugars are not under control and they're still elevated, look at the reasons why. A lot of people who are taking metformin have a hard time controlling their blood sugar. Adding Rescue 105 Max, the Rescue 1250 Plus, the magnesium and the metabolic help, and as additional supplementation to lower that blood sugar. And ultimately, the goal would be to decrease your medicinal medications such as metformin, or if you can get off your metformin if we can control the blood sugar through supplements, because we all know that being on medications runs side effects. Does anybody know what the main side effects of metformin studies have shown? Neuropathy. Diabetic neuropathy is one of the main side effects of metformin usage, and they've shown that the reason is because our body is depleted in B12. B12 malabsorption occurs with metformin usage, so we have to be aware of that. A lot of people are taking metformin now, probably did not know that. So what do we do for that? Is we replenish that. We give patients an additional supplement of B12 to replace some of that depletion that occurs with metformin as well. And if we can decrease the metformin usage by adding supplementation such as Rescue 105 Max, magnesium, and metabolic, we can somehow alleviate that metformin malabsorption that can occur. So treatment options for diabetes, lifestyle changes. What I've said 100 times today, and I think it's really, really important to take away. If you take away anything from this talk today, it's lifestyle changes. You really have to change your lifestyle when you're diabetic or pre-diabetic, because we want to prevent complications. That means eating right, eating the proper amount of fruits, vegetables, eating leaner meats, eating these complex carbohydrates instead of simple carbs. Look at the type of sugar we're ingesting. If you drink regular soda, try and drink diet soda. Try and drink a lot of fluids throughout the day, meaning water, non-caloric drinks. Lowering blood pressure, lowering LDL cholesterol, managing your diabetes to lower blood glucose levels. And then we have here healthy diet and regular exercise are important lifestyle changes as well. And then rescue supplementation. Whoops. So lower high cholesterol and high blood pressure. We can manage diabetes through supplementation through rescue. We can prevent formation of blood clots. And we can also help improve our exercise, Rescue 1250. So, omega-3 fatty acids. Everybody here on the Rescue 1250? A lot of people take the Rescue products here. So I'm a big fan of the Rescue 1250 as that foundation. Anytime we talk about supplementation, we always talk about starting with Rescue 1250. Does anybody know why that is? Well, I'll tell you why. Because omega-3 fatty acids are the building blocks of cells. There's so many benefits to taking Rescue 1250 omega-3. EPA and DHA. We talked about the benefits of EPA about 2 weeks ago, talking about helping with mood and depression. DHA talking about brain health. As benefits of taking this Rescue 1250, the foundation, the building blocks of cells. So we know there's many benefits. It promotes a healthy heart, reduces triglycerides, promotes healthy circulation, balance of natural inflammatory process. Those top four, if you think about it, are some of the main causes of diabetes, right? Cardiovascular disease, triglycerides. We know that diabetes has an inverse relationship when we talk about cholesterol levels. Diabetes increases our bad cholesterol and decreases our good cholesterol, the HDL. And then we talk about improved joint mobility and flexibility. So if we have a problem with exercise, maybe we have some joint pain, adding Rescue 1250 to that will help us improve our lifestyle, maybe get out and walk a little better. Support brain and eye health, maintain overall good health, and lastly, helps with blood sugar metabolism. That's why it works so well with a lot of the other products that we talk about, because it's the foundation, and there's so many benefits to taking the Rescue 1250. I personally love this product. I like the 1250 Plus, which is the vitamin D3. Not only does it have the benefit of adding an antioxidant, but there's benefits to helping blood sugar control with vitamin D. It helps with skeletal uptake of sugar into the muscle belly as well. So Rescue 1250 is something that I stress to my patients as well. And I'm going to talk about what I recommend to my patients who are diabetic, as well as a preventative and as well as a treatment for diabetes. The benefit of glucose control. So what's the benefit? Studies in the United States and abroad have found that improving your glycemic control, meaning your blood sugar, benefits either type 1 or type 2 diabetics we're talking about today. In general, every percentage drop point in your A1C, which is that 3-month window of looking at how your blood sugar is controlled, results in a reduced risk of microvascular complications, eye, kidney, and nerve disease by 40%. So think about that. Being proactive and controlling your blood sugar alleviates some of those complications associated with diabetes, including cardiovascular disease. So being proactive and making these changes. Well, how do we do that? We add the Rescue 105 Max, we add the Metabolac, the Magnesium, and the Land and Sea Fiber. They call this the complete blood sugar combo pack. Without the Land and Sea Fiber, it's called the blood sugar combo pack. You have the 105 Max, the Metabolac, and the Magnesium. How many people take the magnesium supplement here? Is anybody? Great. You know that magnesium is probably the most forgotten about, I guess, mineral that we get magnesium through daily ingestion of food. So replacing that. And the depletion of magnesium can increase your risk of type 2 diabetes, studies have shown. So adding magnesium to this blood sugar combo pack is a great benefit. And the Metabolac came on the market about a year ago, and it's a great product to help control blood sugar. It addresses the metabolic syndrome that we talked about as well, lowering inflammation in the body, controlling blood sugar, helps with our triglycerides as well. So there's a big benefit of taking Metabolac and 105 Max, and Metabolac also helps with obesity, helps with weight loss. So if you have a hard time losing weight, you know, adding Metabolac as well, and I know Dr. Levy talked about some of the weight loss products as well. So adding those combined with it as well are going to be a huge benefit when we talk about controlling our blood sugar and controlling our risk factors associated with type 2 diabetes or pre-diabetes, which are some of the risk factors. Rescue 105 Max is one of the gold standard treatments we recommend for blood sugar control. Well, why is that? Well, there's many ingredients. We got the pumpkin pentose, the Genema silvestre leaf, the bitter melon, the alpha lipoic acid, and the chromium. We know we have antioxidants such as alpha lipoic acid, Genema silvestre leaf, and all of the bitter melon fruit help with insulin production and also that blood sugar craving that sometimes we get. And the pumpkin pentose, the main ingredient in that, it's a 5-carbon sugar. So what that means is that normally sugar is a 6-carbon sugar, and it needs insulin to enter the cell. So if we're insulin resistant, we're not using insulin efficiently enough, sugar cannot enter the cell. So what that pumpkin pentose doesn't need insulin to enter the cell. So that 5-carbon sugar can enter the cell, provides energy for us, and decrease our sugar craving as well. So our body is not craving more energy, more food. So we're alleviating that increase in sugar in the blood by having the 5-carbon sugar enter the cell instead of that 6-carbon sugar. Chromium also is a great trace mineral found in Rescue 105 as well. It helps move blood sugar from the bloodstream into the cells. It's an added benefit in conjunction with insulin. So we talk about blood pressure control. Blood pressure control reduces the risk of cardiovascular disease by 30 to 50%, and also the risk of microvascular complications. Think about that. So blood pressure control reduces the risk of cardiovascular disease. So if we can control our blood sugar on blood pressure, we can reduce our risk of cardiovascular disease. For every 10 millimeters per mercury reduction in systolic blood pressure, the risk for complications related to diabetes reduces by 12%. Reducing diastolic blood pressure from 90 to 80 milligrams reduces the risk of complications of cardiovascular events by 50%. Again, being proactive controls your risk of diabetes and cardiovascular events because of some of the risk factors associated with diabetes. So if we can control our blood pressure, we alleviate some of those risk factors as well. And how do we control our blood pressure through supplementation? We have the cardio power and magnesium. Magnesium is a great way not only to control our blood sugar, but also helps control blood pressure. Cardio power boosts active energy endurance and also improves the efficiency of the heart, because the heart is a muscle, and a muscle needs to have support and increases the pumping of the activity of the heart. So cardio power works really well, and orosine also promotes healthy blood pressure as well. Supports heart rhythm, reduces arrhythmias. I know we talked about earlier this morning about reducing arrhythmias and the role orosine plays in that as well. Orosine also helps energy levels. So if you sometimes feel lethargic, orosine will definitely be a benefit to help give you a little more energy as well, because we can't, remember, we have a hard time pulling sugar out of the blood. And control of blood lipids. Improve control of your LDL cholesterol can reduce cardiovascular complications by 20 to 50%. That's a great number right there. That's great information. LDL cholesterol has such a negative impact on our cardiovascular system. If we can somehow reduce that and actually, reduce our cardiovascular complication risk, that's going to be really, really beneficial to help with some of the complications associated with diabetes. And that's where the LDL XQ10 with the red yeast rice comes in, the level LDL, HDL plus with the flush-free niacin, and also the O3 max, which Dr. Levy talked a little about earlier on. So, to answer our questions of the day, can type 2 diabetes be prevented? Yes. Can people with diabetes live a long and healthy life? Yes. Did everybody at the beginning was the answer to those questions? I hope you did, because it's true. Type 2 diabetes can definitely be prevented, and also we can live long and healthy lives if you are type 2 diabetic by making lifestyle changes and proper, not only in what we eat, our exercise, but also in our health care as well. So who ultimately gets to make the decision on how we're going to control our diabetes and prevent the complications? It's you. You have the right to empower yourself. You become the decision makers in your life. Diabetes depends more on your behavior and lifestyle than any clinical intervention. You can see 1 million doctors in the world for your diabetes, but nothing's going to change until you make that decision. And that's through lifestyle choices and lifestyle changes. Diet, exercise, and we talked about supplementation. The benefits of the Rescue products, Rescue 105 Max, the magnesium, the metaboloc, the Lamnin C fiber, the 1250 plus to control your blood sugar, and we talked about controlling your blood pressure with magnesium, orosine, and cardio power, and also some of your cholesterol levels with the LDL XQ, the LDL level, and also the Rescue 1250. So it's really, really important to understand that you have the ultimate power to make your decisions and control your blood sugar and prevent all these complications from occurring with diabetes. And I'll leave you with one last thought, which is that right there. Okay, great. So any questions at all from what we talked about, or diabetes, or controlling your blood sugar, or some of the complications that go along with diabetes? Question over here. What's that? Safest sugar substitute. Well, that's a great question. Stevia is a great sugar substitute as well that people say is very safe. As you know, I look at non-caloric sugar substitutes. If you're saying to me that you want to use sugar, or would you rather use a non-caloric sugar substitute, I would say a non-caloric sugar substitute is great. Stevia is a great substitute to take for a safe alternative to sugar. Question?
Is neuropathy reversible?
Is neuropathy reversible? That's a loaded question, but I'm going to say I've seen it improve. Now, if anybody suffers from diabetic neuropathy, you know how debilitating it could be or painful it can be, right? So any improvement is an improvement, whether it's 10% or 100% of, if you have improvement, if I could decrease that pain level, at some point you're going to be happy, whether it's 10% or 100%. So the roundabout question is, yes, neuropathy can be reversible, but it can definitely be managed through non-medicinal treatment, because a lot of to treat neuropathy is to treat the pain cycle, and that comes with a lot of complications associated with it. A lot of people are tired, they don't feel right, they feel like they live on another planet when they're on neuropathy medication. So there's vitamin supplementation that you can take that can help with neuropathy and sometimes reverse some of the problems with neuropathy, especially when you're diabetic and you're on metformin. We know that metformin induces B12 malabsorption, so if we can increase that B12 in your body, we can repair some of the damage that occurred from having depleted B12 in your body. And one more question. I love the questions, so please ask me more questions.
Okay, since I am taking metformin, can I take the 105 max at the same time?
That's a great question. No, that's a great question. The question was, if I'm taking any type of hypoglycemic medication, such as metformin or Genumet or something like that, can I take Rescue 105 in combination with it? The answer is yes. You definitely can. The goal of taking this supplementation is to decrease your intake of metformin or any type of medicinal management. I'm not saying you stop it cold turkey, but over time, if your blood sugar looks like it's becoming under control, your doctor is going to decrease that medication level and you're going to continue on the Rescue 105. But yes, you definitely can take the Rescue 105 in conjunction with a hypoglycemic, such as, you know, metformin or Genumet or something like that.
Take the metformin and 105 max at the very same time?
Sure, you can. It's not going to affect the 105 max. Is you take it with every meal, one pill with every meal, because we want to prevent that postprandial spike. So some people say after a meal they get that sugar spike after a meal. Well, we want to prevent that with the 105 max to keep that sugar at a normal level, because studies have shown that the more normal that we keep our sugar, the less complications and the less havoc that can go on in the body. I compare sometimes uncontrolled blood sugar like a time bomb going off in the body, right? It increases oxidative stress and inflammation, and it just goes down from there. So we want to prevent those sugar spikes from happening, and the best way to do that is Rescue 105 Max. The question back there.
How about agave?
Agave. Well, that's a good sweetener too, but you got to understand there's sugar in agave, right? So again, you got to take that in moderation, because even though it's a natural sugar, it's still sugar, and sugar can cause blood sugar spikes. So you really want to be careful. Even though it's a natural sugar, you want to be careful of ingesting too much of that sugar. That's why we look at sugar alternatives to prevent those sugar spikes if you're diabetic. Question?
What do you think of the ketogenic diet?
The ketogenic diet, that's a great diet. That's almost like a clean eating diet is what they call it too sometimes. And that's a great way to control blood sugar as well, because it's a natural way to control your blood sugar. It's a healthy eating lifestyle, and I definitely agree with the ketogenic diet as well, because you're eating complex carbs, you're eating leaner meats as well, so it's really, really beneficial to a lifestyle change. When we talk about making a lifestyle change in combination with supplementation, to do that, it's diet and exercise, and that's a great way to do it. What's that?
Coconut palm sugar.
Coconut palm sugar. So again, that's a sugar.
But it has, when you buy it on the paper there, it says that it doesn't spike your...
Well, coconut doesn't spike your sugar, they say, but there's many conflicting studies about coconut too. They say ingesting too much coconut can put you at a higher risk of developing diabetes as well. So you really got to look at everything in moderation. And I really be cautious of what you read on labels is really not necessarily true, especially if you're pre-diabetic. You really got to be cautious of ingesting anything with sugar in it, because your body cannot use sugar efficiently because insulin is not working correctly. Yes, so does high blood pressure have a role in increasing your blood sugar? Is that correct? Hypertension, yes. Yes, it does. Like we talked about here, and I can go back to the slides here if I can. But uncontrolled blood sugar does increase your risk of developing diabetes, because it's a risk factor when we talk about metabolic syndrome. And if you are diabetic and you have uncontrolled hypertension, it puts more stress on the cardiovascular system, which is already increasing your risk of developing cardiovascular disease.
What about D-ribose?
Ribose as a sugar? That's fine. Is this working? It is. That's fine. D-ribose is fine, but again, it's a sugar. So any type of sugar that you're ingesting is actually going to elevate your blood sugar. So it doesn't matter. A simple sugar or a added sugar, we have to be aware of how much sugar we ingest on a daily basis as well. Does anybody know how much sugar we should ingest as a male or female daily? It's anywhere from 25 to 40 grams of sugar a day. That's like a can of Coke. Okay, so you think about how much sugar we should ingest in a day, it's not that much. And about a month ago we talked about the negative effects of sugar on the body. And sugar can wreak havoc on the body. And the main reason is because it increases inflammation and oxidative stress. And we talk about inflammation and oxidative stress all the time because of the fact what goes on with inflammation and oxidative stress increases the stress level in the body, and we know that inflammation has negative effects on circulation, increases our body's inflammation. And the problem with sugar is like a drug. That the minute that you ingest sugar, it triggers a part of your brain that you want more sugar. It's hard for your body to stop eating sugar as well. It's almost like an addiction when we talk about sugar and the body and how it interacts with the brain. So you got to be really, really careful of how much sugar we ingest and the type of sugar. Like if you're eating processed meats, that's a high amount of sugar in it versus eating unprocessed meats as well. And then we look at the natural sugars, the sugars that come from fruits and vegetables. Those are the good sugars that you want to ingest, and understand that as well, as the added sugar is the bad sugar as well. I don't eat sugar anymore. I stopped eating sugar about a year ago because of such of the negative effects of sugar can have on the body. My kids walk around and say, "Hey Dad, let's have a donut today." And I'm like, "Really?" I look at my head and say, "Oh my God, inflammation is crazy going on in my body if I eat a donut." And like to my kids, I'm like, "Don't eat that out." Like, I just wanted a glazed donut. So, yeah, don't tell a kid he can't have sugar. It's like telling an adult he can't have coffee.
Is stevia considered a natural?
So it's
not a sugar.
right, correct. It's a sugar replacement. So that's an alternative.
Arthritis in the hip.
Arthritis in the hip. Well, claudication is a issue with circulation, meaning that the vessels are narrowing and blood flow is not as smooth as it could be, or not adequate enough to provide the nutrients it needs to an area. So claudication, it can happen in many parts of the body, and hip arthritis and claudication can occur together, and it increases your inflammation, because a lot of the nutrients that control the inflammation in the hip cannot get there if you have claudication in the hip. When we talk about claudication in the legs and the feet as well, that affects circulation and blood flow and healing as well. So, okay, there's a pyramid that you can refer to on the American Dietary Guidelines, and it shows you the breakdown of fruits, vegetables, lean meats, protein, and fats that you can take in and ingest throughout the day. Carbs. You need carbs, but you got to look at the type of carbs you ingest. We talk about simple and complex carbohydrates. Carbohydrates are the ones that are bad for you. They're higher in sugar. The complex carbohydrates are your fruits and your vegetables. They provide many benefits. I think they're going to cut me off, I thought, because I'm talking too long. But
You don't want a low HDL.
no, you want a high HDL. Did I say that wrong? I'm sorry, so you want to increase your HDLs and you want your LDLs to be low, and niacin will increase your HDLs and lower your LDLs.
Carb diet, is that a good diet?
The carbohydrate diet? No, it's not a good diet. I don't think if you want to eat 100 bagels a day, that's not a good diet. It's a carbohydrate diet. Deplete the deposits of fat in your body as well, and you'll lose weight. Yep. So, well, listen. I want one more question. Let's go. One more. I love the questions. I really have questions all day.
What's your opinion on soy? You look it up. Some people say it's bad. Some people say it's good.
That's a great question too. So soy is a good product to do. It's a milk alternative as well. I definitely think there's a benefit for soy, and if you prefer to take it, I'd say take it as well. I'm not too familiar with the exact literature on the negatives of ingesting soy as well, but there's certain people who use soy. There might be stuff is not good for you. But in moderation, it's okay, but in high ingestion, I know Dr. Levy talked about alcohol consumption earlier on, but you know, there's no benefit in drinking beer. You know, I personally think it might make some things more exciting if you drink beer, but you know, and pretzels, you know, it's a great snack alternative versus chips or anything else. So pretzels and beer. We'll have some later. One more question. Two more questions. Three more questions.
To go see the pigs, it's good to have the beer and the pretzels.
To go see the Iron Pigs, well, you might need beer and pretzels if they're losing. Let me get one more back here.
Peripheral neuropathy.
If you have neuropathy, what is
In your feet.
what can you do on that?
So what can you do for neuropathy? So we talked about that earlier. So if you're diabetic, or if you're not diabetic, so there's something called idiopathic neuropathy. Neuropathy that's due to some unknown reason. Sometimes it's toxically induced if you undergone chemotherapy, or just have neuropathy, smaller pill. You still get the same benefits of the DHA and the EPA. It's just a smaller pill as well for the 2500G. Some people prefer to take the 2500 TG as well. It's a smaller pill versus the 1250. I like the 1250 plus. I know it's a big pill, but I feel like I'm doing something. When I take a big pill like that, I feel great. So, any other questions? Oh, there's one more in the, I know that guy. I'm going to charge you for this one.
How's it work?
What's that?
How does insulin work?
Insulin. I paid him to ask that question. Is when you don't have insulin at all. So insulin is a key that unlocks the cell to allow sugar in, simply put. Did that answer your question? Thanks for asking it, sir.